Trigeminal neuralgia is a type of facial pain that occurs suddenly and with severe, horrific pain in one side of the face, usually lasting a few seconds to a few minutes. Patients often describe this as being shocked by electricity or a hot poker in the face. Often there is a trigger. Patients would note that talking, chewing, swallowing, or even mild wind blowing their face could trigger this pain. In terms of the cause of this trigeminal neuralgia, it's not quite known why, but it's thought to be some sort of short circuit between the nerves in the trigeminal nerve, which is the nerve that supplies the sensory information from the face to the brain. Most commonly, with a newly diagnosed trigeminal neuralgia, patients are treated with medications. And there are various different types of medications that can be tried. The most common one is Tegretol or carbamazepine, which is actually an anticonvulsant or an anti-seizure medication. However, unfortunately, with time, the patients usually would need higher doses of the medication, patients then might develop side effects from the higher doses of medications, or even the medications might not work anymore. Gamma knife radiosurgery, the radiofrequency lesioning, which is what causes the burning of the nerve, and the chemical rhizotomy, they all causes the insulation in the nerves to change, thereby reducing the pain sensation in the patient. So when patients come to see us, we really discuss with the patients and their family, the whole set of options with them. Gamma knife, even though it has a knife word in it, it's really not a surgery that uses a knife. Gamma knife radiosurgery, which is a procedure where we focus very high doses of radiation very precisely on the trigeminal nerve, reducing the pain for the patient. The gamma knife treatment is an outpatient treatment. It's a one-day treatment where a patient comes in early in the morning. It's a very complex treatment, require a lot of computers, scans, and personnel. The team members include myself, a radiation oncologist, a radiation physicist, a nurse, a radiation therapist. So it's a large team of about 5 or 6 people. The reason why we have so many people is so that we can make sure that the treatment always goes perfectly. So the Boston Gamma Knife Center at Tufts Medical Center was established in 1999, and since then we've treated nearly 2,000 patients. We have the only gamma knife in Massachusetts, in fact in all of northern New England. So we actually have a large group of patients that come to see us for a gamma knife treatment for trigeminal neuralgia.